My name's Dan Stone. I'm a specialist of urogynecology, also known as female pelvic medicine and reconstructive surgery. There's multiple causes of urinary leakage. Some of the most common causes is something called stress urinary incontinence and urge urinary incontinence. So overactive bladder is a condition that includes urgency, meaning you have to rush to the restroom, frequency, meaning you have to go to the bathroom often, and nocturia, meaning you have to get up at night to use the restroom. With the urgency, if you don't make it to the restroom, we call that urge urinary incontinence. There's this muscle in the bladder called the detrusor muscle. And this muscle, its main objective is to empty the bladder when we want it to empty. Now, if this detrusor muscle becomes overactive, it wants to squeeze when we're not ready to use the restroom. When we discuss treatments for overactive bladder, we can divide it into conservative behavioral therapy and medical therapy. And then there's also procedures that can be done later on if medications don't work. So for conservative or behavioral therapy, we discuss bladder retraining. And the idea behind bladder retraining is that you're trying to train your bladder to listen to your brain instead of the other way around. And so the first step of bladder retraining is you time your voids. And so if you find yourself going every hour during the day, then you start going every 45 minutes instead to avoid those episodes of urgency. Once you're doing that, you try to avoid these episodes of urgency. But once you have an episode of urgency, instead of rushing to the restroom, you try to wait, do Kegels or pelvic floor muscle exercises to distract the pelvic floor. And once that urgency passes, then you go. And over time, you eventually lengthen out at the times that you void until you're having a regular voiding pattern again. It's easier said than done, and it's a very difficult thing to do, but it is doable. Pelvic floor physical therapy can also be useful with this condition. Strengthening the pelvic floor tends to help the detrusor muscle function normal. There's dietary things that can be done. Avoiding things like coffee, tea, soda, artificial sweeteners, juices, alcohol can help the bladder not be as spasmodic, not be overactive. Treating other conditions such as losing weight can help. Treating constipation can help. If conservative measures fail, there's also medical therapy. For a postmenopausal patient, vaginal estrogen can help. Also, there's medications that can calm the bladder down. There's two main types of oral medications that can be used. One is a group of medications, and it's anticholinergic medications. And there's about 6 of them on the market. They work very well, but they do have some side effects. These include dry mouth, dry eyes, constipation. Not everyone gets these side effects, but they can be very bothersome if someone does get these side effects. The other medication on the market is called mirabegron, and it also helps with the bladder control, and it works very well. Its main side effect is a slight increase in blood pressure. For anyone that doesn't have high blood pressure, you'd be a candidate to try this medication. Our office also specializes in the advanced therapies of overactive bladder and urge urinary incontinence. So some of the advanced therapies are going to be botox injection into the bladder wall. And how this works is botox, it works very simply. It paralyzes muscle. So botox injection into the bladder, we partially paralyze that bladder wall to help decrease the urgency, decrease the frequency, and allow you more time to get to the restroom. There's pros and cons with any type of procedure. The advantage of this procedure is it works very well. The disadvantage is it tends to wear off after 6 to 9 months. Sometimes it works too well and that you have to self-catheterize for 1 to 2 weeks. And there's also an increased risk of urinary tract infections. There's other advanced therapies. One therapy is sacral neuromodulation. And how this works is a wire is placed near the sacral nerve and it's stimulated. By stimulating this nerve, the bladder and the brain start communicating better. And this can decrease urgency, decrease frequency, and decrease getting up at night. And it works very well. The advantage is it's a permanent implant and it can last, depending on which device is used, up to 18 years. The disadvantage is it's a larger procedure. Usually it involves 2 separate procedures for the full implant to be placed. Lastly, there's percutaneous tibial nerve stimulation. We stimulate the tibial nerve, which is near the ankle. It's a very small needle that goes through the skin and stimulates this nerve. The nice thing is it's minimally invasive. There is almost no risk involved in doing this therapy. The disadvantage is it's a weekly therapy, and this weekly therapy lasts 12 weeks, so it's something that can be time consuming.
If you or a loved one suffer from one or more of these conditions, please give our clinic a call at 602-788-1521, and myself or one of my partners would be happy to see you. We are located near the 51 in Glendale Avenue in Phoenix, Arizona. Thank you for watching, and we look forward to hearing from you.